Hello friends, welcome to my YouTube channel Knowledge for All. Before starting my video, I request you to please subscribe my channel and watch more video. So now let's start. It's video about gynecology or midwifery and maternal health nursing part second. It's a part second. So now let's start. In my last video, I discussed 50 questions. So now next one is 51. 51 to 100 question in this video. So now let's see. In following which is not a subjective symptom of pregnancy during first trimester. Option: amenorrhea, quickening, morning sickness and frequency of micturition. Right answer is quickening. Quickening is not a subjective symptom of pregnancy during first trimester. Next question. Frequency of micturition is an important symptom of pregnancy during first trimester. It is occurred due to: option: resting of the enlarged uterus on the bladder, increment in blood volume, maternal weight gain, and all of the above. Right answer is resting of the enlarged uterus on the bladder. Next question. Cervical changes that take place during pregnancy are: expect. Option: cervix becomes soft, cervix feel like the lips of the mouth, bluish discoloration of the cervix, cervix feel like the tip of nose. Right answer is cervix feel like the tip of nose. Next question. Size of the uterus by 12 weeks of pregnancy is: option: like hen's egg, like cricket ball, like a fetal head, and like football. Right answer is like a fetal head. Size of the uterus by 12 weeks of pregnancy is like a fetal head. Next question. Dusky hue of the vestibule and anterior vaginal wall during pregnancy is known as: option: Jack-Mears sign, Osiander sign, Hager's sign, and Godel's sign. Right answer is Jack-Mears sign. Dusky hue of the vestibule and anterior vaginal wall during pregnancy is known as Jack-Mears sign. Next question. Softening of the cervix during pregnancy is termed as: option: Jack-Mears sign, Osiander sign, Hager's sign, and Godel's sign. Right answer is Godel's sign. Softening of the cervix during pregnancy is termed as Godel's sign. Next question. In following which is not a pregnancy sign? Option: Chadwick sign, Brzezinski sign, Hager's sign, and Godel's sign. Right answer is Brzezinski. Brzezinski is not a pregnancy sign. Next question. Urine containing HCG is an important sign of: option: meningitis, acute renal failure, pregnancy, and renal tumor. Right answer is pregnancy. Urine containing HCG is an important sign of pregnancy. Next question. In following which is not a pregnancy test? Option: ELISA test, Benedict test, radioimmunoassay, fluoroimmunoassay. Right answer is Benedict test. Benedict test is not a pregnancy test. Next question. By USG, intradecidual gestation sac is identified by as early as: option: second week of gestation, fifth week of gestation, 3 to 4 months of gestation, and 10 to 12 weeks of gestation. Right answer is fifth week of gestation. By USG or ultrasonography, Intradecidual gestation sac is identified by as early as 5th week of gestation. Next question. The important feature of second trimester of pregnancy is option amenorrhea, quickening, anorexia and vomiting. Right answer is quickening. Quickening is the important feature of second trimester of pregnancy. Next question. Perception of active fetal movement by the pregnant mother at about 18 to 20 weeks of gestation is termed as option Montgomery tubercle, quickening, Gödel sign and Braxton Hicks contraction. Right answer is quickening. Perception of active fetal movement by the pregnant mother at about 18 to 20 weeks of gestation is termed as quickening. Next question. Oligohydramnios is related to option disorder of blood volume during pregnancy, disorder of amniotic fluid volume during pregnancy, disorder of vaginal bleeding during pregnancy, and none of the above. Right answer is disorder of amniotic fluid volume during pregnancy. Oligohydramnios is related to disorder of amniotic fluid volume during pregnancy. Next question. At the 16th week of gestation, the height of the uterus is option midway between the umbilicus and symphysis pubis, at the level of umbilicus, at the junction of the lower third and upper two-thirds of the distance between the ensiform cartilage and umbilicus, and all the level of ensiform cartilage. Right answer is midway between the umbilicus and symphysis pubis. At the 16th week of gestation, the height of the uterus is midway between the umbilicus and symphysis pubis. Next question. Fundal height at 24th week of gestation is about option midway between the umbilicus and symphysis pubis, at the level of umbilicus, at the junction of the lower third and upper two-thirds of the distance between the ensiform and cartilage and umbilicus, and on the level of ensiform cartilage. Right answer is at the level of umbilicus. Fundal height at 24th week of gestation is about at the level of umbilicus. Next question. Fundal height at 36th week of gestation is about option midway between the umbilicus and symphysis pubis, at the level of umbilicus, at the junction of the lower third and upper two-thirds of distance between the ensiform cartilage and umbilicus, and all the level of ensiform cartilage. Right answer is all the level of ensiform cartilage. Fundal height at 36th week of gestation is about all the level of ensiform cartilage. Next question. Fetal parts can be palpated first time during option first trimester, second trimester, third trimester and just after conception. Right answer is second trimester or 8 at 20 week. Fetal parts can be palpated first time during second trimester at 28 week. Next question. In following which is not symptom of second trimester of pregnancy? Quickening, fundal height at ensiform cartilage, Montgomery tubercle, detection of fetal heart sound. Right answer is fundal height at ensiform cartilage. Fundal height at ensiform cartilage is not a symptom of second trimester of pregnancy. Next question. After 36 weeks of gestation, the fundal height comes to 32 week level. It occurs because of option fetus becomes short, reduction in amount of amniotic fluid, Size of uterus decreased. Engagement of the presenting part. Right answer is engagement of the presenting part. After 36th week of gestation, the fundal height comes to 32-week level. It occurs because of engagement of the presenting part. Next question. Relation of the long axis of the fetus to long axis of the uterus is known as option lie, presentation, attitude and position of the fetus. Right answer is lie. Lie is the relation of the long axis of the fetus to long axis of the uterus. Next question. The part of the growing fetus which occupies the lower uterine pole is called as option lie, attitude of the fetus, presentation of the fetus and position of the fetus. Right answer is presentation of the fetus. The part of the growing fetus which occupies the lower uterine pole is called presentation of the fetus. Next question. The relation of the various parts of the fetus to one another is called as option lie, attitude, presentation and position. Right answer is attitude of the fetus. The relation of the various parts of the fetus to one another is called attitude of the fetus. Next question. Relation of the denominator to the various quadrants of the maternal pelvis is termed as option lie, attitude, presentation and position. Right answer is position of the fetus. Relation of the denominator to the various quadrants of the maternal pelvis is termed as position of the fetus. Next question. The commonest lie of the human fetus is option longitudinal, transverse, oblique and unstable. Right answer is longitudinal. Longitudinal lie is the commonest lie of the human fetus. Next question. Commonest presentation of the human fetus is option cephalic, podalic, shoulder and transverse. Right answer is cephalic. Cephalic presentation is the most commonest presentation of the human fetus. Next question. Universal attitude of human fetus is option extended, flexion, sometime extended and sometime flexed and high extended. Right answer is flexion. Flexion is the universal attitude of human fetus. Next question. The suture that separates the occipital bone and the two parietal bones is option lambdoid suture, coronal suture, frontal suture and sagittal suture. Right answer is lambdoid suture. Lambdoid suture that separates the occipital bone and the two parietal bones. Next question. Suboccipito-bragmetic diameter of human fetal skull is about option 9.5 cm, 10 cm, 11.5 cm and 14 cm. Right answer is 9.5 cm. Suboccipito-bragmetic diameter of human fetal skull is about 9.5 cm. Next question. Suboccipito-frontal diameter of human fetal skull is about option 9.5 cm, 10 cm, 11.5 cm and 14 cm. Right answer is 10 cm. Suboccipito-frontal diameter of human fetal skull is about 10 cm. Next question. In human fetal skull, occipito-frontal diameter is about 9.5 centimeter, 10 centimeter, 11.5 centimeter and 14 centimeter. Right answer is 11.5 centimeter. Next question. In human fetal skull, mean to vertical diameter is about option 9.5 centimeter, 10 centimeter, 11.5 centimeter and 14 centimeter. Right answer is 14 centimeter. Next question. In human fetal skulls, distance between the center of the brachma to the nape of the neck is termed as option suboccipito-bragmetic, submentobragmetic, suboccipito-frontal and mentovertical. Right answer is suboccipito-bragmetic. In human fetal skull, distance between the center of the brachma to the nape of the neck is termed as suboccipito-bragmetic. Next question. In human fetal skull, distance between the center of the brachma to the junction of floor of the mouth and the neck is termed as option suboccipito-bragmetic, submentobragmetic, suboccipito-frontal and mentovertical. Right answer is submentobragmetic. In human fetal skull, distance between the center of the brachma to the junction of floor of the mouth and neck is termed as submentobragmetic. Next question. In human fetal skull, highest diameter is option suboccipito-bragmetic, submentobragmetic, suboccipito-frontal and mentovertical. Right answer is mentovertical. Mentovertical. In human fetal skull, highest diameter is mentovertical. Next question. In human fetal skull, distance between the highest point of the sagittal suture to the midpoint of the chin is termed as option suboccipito-bragmetic, submentobragmetic, suboccipito-frontal and mentovertical. Right answer is mentovertical. In human fetal skull, distance between the highest point of the sagittal suture to the midpoint of the chin is termed as mentovertical. Next question. Alteration in the shape of fetal head while coming through the resistant birth passage during labor is termed as option molding, gestation, caput succedaneum and presentation. Right answer is molding. Alteration is in the shape of fetal head while coming through the resistant birth passage during labor is termed as molding. Next question. Angle of inclination in human female is option 55 degree, 90 degree, 45 degree and 75 degree. Right answer is 55 degree. Angle of inclination in human female is 55 degree. Next question. Highest diameter of female pelvis is option anterior, posterior, transverse, oblique and all are equal. Right answer is anterior, posterior. Highest diameter of female pelvis is anterior, posterior. Next question. A female who has become pregnant but never has given birth to live baby is termed as option nullipara, nulligravida, multipara and purpura. Right answer is nullipara. A female who has become pregnant but never has given birth to live baby is termed as nullipara. Next question. A female who has given birth to one viable child is termed as option primipara, multipara, nulligravida and primigravida. Right answer is primipara. A female who has given birth to one viable child is termed as primipara. Next question. A female who is pregnant for the first time is termed as option primipara, multipara, nulligravida and primigravida. Right answer is primigravida. A female who is pregnant for the first time is termed as primigravida. Next question. Normal labor is also known as option eutokia, dystocia, delivery and parturition. Right answer is eutokia. Normal labor is also known as eutokia. Next question. Abnormal labor is also known as option eutokia, dystocia, delivery and parturition. Right answer is dystocia. Abnormal labor is also known as dystocia. Next question. Process of giving birth is known as option dystocia, eutokia, gravida and parturition. Right answer is parturition. Process of giving birth is known as parturition. Next question. In following which is not a criteria of normal labor? Option spontaneous in onset, vertex presentation, duration of labor is more than 20 hours without any complications. Right answer is duration of labor is more than 20 hours. Next question. In following which is a welcome sign of pregnancy? Option engagement, lightning, descent and internal rotation. Right answer is lightning. Lightning is a welcome sign of pregnancy. Next question. Expulsion of cervical mucus mixed with blood is called as option effacement of the cervix, lightening and retraction. Right answer is expulsion of cervical mucus mixed with blood is called as Next question. Duration of first stage of labor in primigravida is approximately option 10 to 12 hours, 6 to 8 hours, 30 minutes and 2 hours. Right answer is 10 to 12 hours. Duration of first stage of labor in primigravida is approximately 10 to 12 hours. Next question. Duration of first stage of labor in multigravida is approximately 10 to 12 hours, 6 to 8 hours, 30 minutes and 2 hours. Right answer is 6 to 8 hours. Duration of first stage of labor in multigravida is approximately 6 to 8 hours. Next question. Duration of third stage of labor is option 2 hours, 15 minutes, 4 hours and 45 minutes. Right answer is 15 minutes. Duration of third stage of labor is 15 minutes.